Have you ever felt unusually fatigued, experienced difficulty concentrating, or noticed strange sensations like tingling or numbness in your hands or feet, and you couldn't quite figure out why? You're not alone. For many older adults, these symptoms can be dismissed as just another part of aging. What if they were signs of something much more serious? Something that, if left unaddressed, could significantly impact your quality of life? Vitamin B12 deficiency is one of the hidden dangers that often goes unnoticed, especially in seniors. Unlike more obvious health issues like joint pain or high blood pressure, B12 deficiency can creep up quietly, often masquerading as general fatigue or mild discomfort. However, the consequences of this deficiency can be severe. Left untreated, it can lead to irreversible nerve damage, cognitive decline, and even heart problems. So, how do you know if your body is trying to send you a warning signal? Today, we'll be diving into the often overlooked yet crucial topic of vitamin B12 deficiency in seniors. You'll learn exactly what B12 does for your body, why seniors are at a higher risk for deficiency, and how to recognize the warning signs early on. Most importantly, we will discuss practical solutions, what you can do to maintain healthy levels of this essential vitamin and safeguard your health as you age, whether you're concerned about your own health or looking out for an older loved. 1. Understanding B12 deficiency can make a world of difference. By the end of this article, you'll have the knowledge to take action, whether that means adjusting your diet, consulting with your healthcare provider, or simply becoming more aware of the subtle signs that could indicate something is wrong. We want you to feel empowered to make informed decisions that could dramatically improve your quality of life and prevent long-term complications. At Senior Health, we are dedicated to providing valuable insights to help you and your loved ones stay healthy and informed. So, make sure to subscribe to our channel for more expert advice on senior health. If you found this information helpful, please like and comment below to share your thoughts or experiences with vitamin B12 deficiency. Let's spread the word so we can help others live healthier, more vibrant lives. Understanding vitamin B12 deficiency in seniors. Vitamin B12, also known as cobalamin, is a water-soluble vitamin that plays an essential role in several critical functions in the body. It is involved in the production of red blood cells, DNA synthesis, and maintaining the health of the nervous system. In fact, without enough B12, the body cannot function optimally, and a deficiency can lead to a host of serious health problems. Seniors, however, are particularly at risk for B12 deficiency, and understanding why this happens, along with its underlying causes, is the first step to addressing the issue. Why seniors are at higher risk for vitamin B12 deficiency. As we age, our bodies undergo a variety of changes, and many of these can contribute to a diminished ability to absorb vitamin B12. The following factors are some of the key reasons why older adults are more susceptible to B12 deficiency. Decreased stomach acid production. One of the main ways our bodies absorb vitamin B12 is through a process that requires stomach acid. As we age, the production of stomach acid naturally decreases. This reduced acid makes it more difficult for the body to separate B12 from food, leading to less efficient absorption, medical conditions, and surgeries. Many older adults have conditions that interfere with nutrient absorption. For example, gastrointestinal disorders, conditions such as Crohn's disease, celiac disease, or irritable bowel syndrome, IBS, can affect the intestines, where B12 is absorbed. Surgical procedures. Seniors who have had surgeries that affect the digestive system, such as weight loss surgeries or gastric bypass, may have a reduced ability to absorb B12 properly. Medications that interfere with B12 absorption. Many common medications taken by older adults can interfere with vitamin B12 absorption. These include proton pump inhibitors, PPIs, and H2 blockers. These medications, used to treat acid reflux and GERD, reduce stomach acid and, as a result, hinder B12 absorption. METF or MIN, often prescribed for type 2 diabetes. This medication has been linked to B12 deficiency, as it affects the body's ability to absorb the vitamin. Antibiotics and antacids. Long-term use of these can also disrupt the gut flora or acid balance, impacting B12 absorption. Dietary habits. Poor nutrition. A senior's diet may lack sufficient B12-rich foods. While B12 is found in animal-based products like meat, dairy, and eggs, those who follow vegetarian or vegan diets are especially at risk, as plant-based foods do not contain vitamin B12 unless they are fortified. Appetite changes. As people age, they may experience a loss of appetite or difficulties in chewing and swallowing, which can result in lower food intake, further contributing to nutrient deficiencies. The importance of vitamin B12 for seniors. Vitamin B12 is crucial for many aspects of health, particularly in seniors. Its benefits extend beyond just maintaining energy levels. It is integral to a wide range of bodily functions. Here's a look at the major ways vitamin B12 supports senior health. Cognitive health. One of the most critical roles that B12 plays in the body is in supporting brain function. This vitamin is necessary for the production of myelin, the protective covering around nerve fibers that ensures effective communication between nerve cells. Without enough B12, the brain can suffer, leading to memory problems, difficulty concentrating, and mood changes. Memory and cognitive decline. B12 deficiency has been linked to an increased risk of cognitive decline and even Alzheimer's disease. In fact, studies suggest that low B12 levels in seniors may accelerate memory loss and confusion, which can lead to dementia. Neurological function. B12 is essential for maintaining the health of the nervous system. A deficiency can lead to nerve damage, causing symptoms such as numbness, tingling, or even difficulty walking. In severe cases, it can lead to permanent nerve damage, which can severely impair mobility and independence. Peripheral neuropathy. This condition involves nerve damage in the arms and legs, causing symptoms like numbness, tingling, and weakness. It is a common symptom of B12 deficiency in seniors. Red blood cell production. Vitamin B12 is crucial for the production of red blood cells. A deficiency can lead to megaloblastic anemia, a condition where the body produces abnormally large red blood cells that don't function properly. This leads to reduced oxygen circulation, causing fatigue, weakness, and shortness of breath. Energy levels and fatigue. One of the most common early signs of B12 deficiency is fatigue, because B12 is involved in energy production at the cellular level. A deficiency can leave seniors feeling unusually tired, even after adequate rest. It can also make it more difficult for the body to repair itself after physical exertion, leading to chronic tiredness. Mood and mental health. Vitamin B12 plays a significant role in the synthesis of serotonin, a neurotransmitter responsible for regulating mood. Low levels of B12 can contribute to mood changes, including feelings of depression, irritability, and anxiety. Seniors with B12 deficiency are at an increased risk of developing depression and other mental health issues. Heart health. Vitamin B12 helps to lower homocysteine levels in the blood, a risk factor for heart disease. High levels of homocysteine can damage blood vessels and increase the likelihood of blood clots, which can lead to heart attacks or strokes. Maintaining adequate B12 levels is therefore essential for maintaining cardiovascular health in seniors. Risk factors for B12 deficiency. Certain factors increase the likelihood of developing a B12 deficiency. Here's a breakdown of the most common risk factors. Age. As we age, the body's ability to absorb B12 from food decreases, making older adults particularly vulnerable to deficiency. Dietary choices. People who follow vegetarian or vegan diets are at higher risk, as B12 is found almost exclusively in animal-based foods. Without fortified foods or supplements, they may not get enough B12. Medical conditions. Pernicious anemia. This is an autoimmune condition that prevents the stomach from producing intrinsic factor, a protein necessary for B12 absorption. Gastrointestinal disorders. Conditions like Crohn's disease, celiac disease, or ulcerative colitis can damage the intestines, where B12 is absorbed. Medications. Long-term use of certain medications, like proton pump inhibitors, H2 blockers, and metformin, can reduce B12 absorption and increase the risk of deficiency. Vitamin B12 deficiency is often an overlooked issue among seniors, but its impact can be profound. From cognitive decline and mood changes to fatigue and nerve damage, the consequences of low B12 levels can affect nearly every aspect of health. The good news is that with awareness and proactive management, this deficiency can be addressed before it causes permanent damage. In the next section, we will dive deeper into the specific signs and symptoms of vitamin B12 deficiency, helping you recognize the early warning signs and take action before the condition worsens. Signs and symptoms of vitamin B12 deficiency in seniors. Vitamin B12 deficiency can manifest in a wide range of symptoms, many of which are subtle and easy to overlook, especially in older adults. These symptoms can often be mistaken for general aging or other health issues. Recognizing the early warning signs is crucial to addressing the deficiency before it leads to irreversible damage. Below is a detailed breakdown of the most common and serious signs and symptoms of B12 deficiency in seniors. 1. Fatigue and weakness. Description. One of the most common symptoms of vitamin B12 deficiency is chronic fatigue and unexplained weakness. Seniors with low B12 levels may feel tired even after getting plenty of rest. This happens because B12 is essential for the production of red blood cells, which carry oxygen throughout the body. Without enough B12, the body cannot produce enough healthy red blood cells, leading to a condition called anemia. Anemia, in turn, reduces oxygen delivery to tissues, leaving you feeling drained and weak. Why it happens? B12 plays a key role in the production of red blood cells. When you don't have enough of it, your body produces large, immature red blood cells that are not capable of transporting oxygen efficiently. As a result, tissues and organs do not get the oxygen they need to function properly, leading to fatigue. Possible solutions. Dietary changes. Ensure you are getting enough B12-rich foods, such as meats, fish, dairy products, and fortified cereals. Supplements. If dietary changes are not sufficient, B12 supplements may be necessary to restore adequate levels. Medical consultation. If fatigue is unexplained and persistent, a blood test to check B12 levels is essential. 2. Numbness or tingling in the hands and feet. Description. Numbness, tingling, or a pins and needles sensation in the hands, feet, or legs is another common symptom of B12 deficiency. This happens because B12 is crucial for nerve function. Without adequate B12, nerve damage can occur, leading to these abnormal sensations. Why it happens? B12 helps produce myelin, the protective covering around nerves. When B12 is deficient, the nerves become damaged, and the signals they send to the brain can become misinterpreted, causing sensations of numbness or tingling. Possible solutions. B12 supplementation. Taking B12 supplements or getting B12 injections. can help reverse nerve damage if detected early. Medical advice: if these symptoms persist or worsen, it's important to see a healthcare provider, as they could be signs of nerve damage that may become permanent if not addressed. 3. Cognitive decline and memory issues. Description: memory loss, confusion, and difficulty concentrating are other red flags for B12 deficiency. Many seniors experience mild cognitive decline as they age, but when B12 deficiency is the cause, the symptoms can become more pronounced and may even mimic conditions like dementia or Alzheimer's disease. This can lead to difficulty with tasks such as remembering names, finding the right words, or following through with daily activities. Why it happens: B12 plays a significant role in maintaining brain health. It is essential for the production of neurotransmitters that help with memory and cognition. A deficiency in B12 can lead to a reduction in these neurotransmitters, affecting mood and mental clarity. Over time, this can result in significant cognitive decline. Possible solutions: early intervention. Taking B12 supplements at the onset of cognitive symptoms can often prevent further damage. Dietary improvements, including more B12-rich foods in your diet, such as eggs, cheese, and fortified cereals, may help support cognitive health. Cognitive exercises. Engaging in mentally stimulating activities such as puzzles, reading, or learning new skills can also aid in brain health. 4. Mood changes, depression, and irritability. Vitamin B12 is essential for the production of serotonin, a neurotransmitter that regulates mood. A deficiency in B12 can lead to feelings of depression, irritability, and mood swings. Seniors who experience unexplained mood changes may be suffering from a B12 deficiency rather than just getting older. Why it happens: a lack of B12 affects the body's ability to produce serotonin and other mood-regulating chemicals. This can lead to changes in mood, feelings of hopelessness, or depression. Seniors may also experience irritability or feelings of anxiety due to the physical and mental toll of the deficiency. Possible solutions: B12 supplementation. Taking B12 supplements can help restore the body's ability to produce mood-regulating chemicals. Psychological support, in addition to addressing B12 deficiency. Seniors may benefit from counseling or support to manage mood changes and anxiety. 5. Anemia. Description: one of the most well-known effects of B12 deficiency is megaloblastic anemia. This condition is characterized by the production of large, abnormal red blood cells that cannot carry oxygen properly. As a result, the body may experience symptoms such as pale skin, dizziness, shortness of breath, and fatigue. Why it happens: vitamin B12 is crucial for the production of healthy red blood cells. Without enough B12, the body produces abnormally large red blood cells that cannot function properly, leading to anemia. This condition can exacerbate the fatigue and weakness already caused by a lack of oxygen in the body. Possible solutions: B12 supplementation. Treating anemia requires correcting the B12 deficiency. This may involve B12 shots or high-dose oral supplements. Iron-rich foods. In addition to B12, incorporating iron-rich foods like spinach, beans, and red meat can help combat anemia symptoms. 6. Digestive issues, loss of appetite, constipation, weight loss. Description: vitamin B12 deficiency can lead to a variety of digestive problems, including a loss of appetite, constipation, and unexplained weight loss. These symptoms are often overlooked in seniors, as they are sometimes attributed to general aging or other gastrointestinal issues. Why it happens: B12 plays a key role in maintaining the health of the digestive system. A lack of B12 can lead to slow digestion, reduced appetite, and a slowing of metabolic processes. which can result in weight loss and constipation. Possible solutions: improve diet, adding more fiber-rich foods to your diet and ensuring adequate hydration can help relieve constipation. B12 supplementation. Regular supplementation can help improve appetite and digestion by restoring proper B12 levels. 7. Heart palpitations and shortness of breath description. In more severe cases of B12 deficiency, individuals may experience heart palpitations or shortness of breath. These symptoms are often related to the anemia caused by low B12 levels, as the body struggles to get enough oxygen to tissues and organs. Why it happens? Without sufficient B12, the body's ability to produce red blood cells is compromised, leading to anemia. As a result, the heart works harder to compensate for the lack of oxygen in the blood, which can cause irregular heartbeats and shortness of breath. Possible solutions: immediate treatment. If you are experiencing heart palpitations or shortness of breath, it's important to see a healthcare provider immediately. Correcting the B12 deficiency may help alleviate these symptoms. Monitoring B12 levels. Regular checkups to monitor B12 levels can help prevent severe symptoms from developing. When to see a doctor. If you or a loved one is experiencing any of the symptoms listed above, it's important to consult with a healthcare provider. B12 deficiency can be diagnosed with a simple blood test. An early intervention is key to preventing permanent damage. If left untreated, B12 deficiency can lead to irreversible nerve damage, cognitive decline, and other serious health issues. Key warning signs to seek medical attention: persistent fatigue that doesn't improve with rest, numbness or tingling in the hands and feet, memory loss or confusion that worsens over time, unexplained mood changes, including depression or irritability, difficulty breathing or heart palpitations. Recognizing the signs of vitamin B12 deficiency is crucial for preventing long-term health complications in seniors. Early detection and treatment can help prevent irreversible damage to the nervous system, cognitive function, and overall well-being. In the next section, we'll explore actionable steps you can take to prevent and manage B12 deficiency so you can maintain a healthy, active lifestyle. How to prevent and address vitamin B12 deficiency in seniors. Vitamin B12 deficiency can have serious consequences if left untreated, but the good news is that with the right steps, it can be prevented or managed. In this section, we will provide you with practical guidelines and solutions to help seniors maintain adequate B12 levels and prevent the negative effects of deficiency. Whether you are looking to prevent this deficiency or address it early, the following strategies will help ensure optimal health and well-being. 1. Incorporating vitamin B12-rich foods into your diet. One of the most effective ways to prevent vitamin B12 deficiency is through dietary changes. Vitamin B12 is naturally found in animal-based products, so seniors who follow a vegetarian or vegan diet should pay special attention to their B12 intake. B12-rich foods to include in your diet: meat and poultry, beef, lamb, chicken, and turkey are all excellent sources of vitamin B12. Opt for lean cuts to make these meats healthier. Fish and shellfish. Fish like salmon, tuna, and sardines, as well as shellfish such as clams, oysters, and crab, are high in B12 and are great additions to your diet. Dairy products. Milk, yogurt, and cheese are rich in B12. For seniors who may have difficulty digesting milk, lactose-free or dairy alternatives, such as fortified almond milk, can provide B12. Eggs. Eggs are a great source of B12, especially in the yolk. They are also a versatile food that can be easily included in a variety of meals. Fortified foods. Many plant-based products, such as cereals, plant-based milks, almond, soy, oat, and nutritional yeast, are fortified with vitamin B12. These options are particularly important for those who follow vegetarian or vegan diets. Serving suggestions. Try incorporating fish into your meals a few times a week, such as grilled salmon with vegetables or tuna salad. Start your day with a fortified cereal or add a dollop of yogurt to your morning routine. For vegetarians or vegans, include fortified plant-based milks in smoothies, cereals, or coffee. Incorporate eggs into your diet through omelets, scrambled eggs, or as a topping for salads. 2. Vitamin B12 supplements. While dietary changes are an important part of preventing and addressing B12 deficiency, some seniors may still find it difficult to get enough vitamin B12 through food alone. This is especially true for those with absorption issues or dietary restrictions. In these cases, vitamin B12 supplements can be an excellent option. Forms of vitamin B12 supplements. Oral tablets. These are the most common form of vitamin B12 supplementation. B12 tablets come in various doses, so it's essential to follow the dosage recommended by your healthcare provider. Sublingual tablets. These dissolve under the tongue, and some people find that they are better absorbed than regular tablets, especially if they have difficulty absorbing nutrients through the digestive system. Liquid drops. For those who have trouble swallowing pills, liquid B12 supplements may be an easier option. B12 injections. In some cases, B12 injections may be prescribed by a doctor, especially if absorption from food or oral supplements is insufficient. These are typically given once a month, although the frequency may vary based on individual needs. How to choose the right supplement. Talk to your doctor about the best type and dosage of B12 for your specific needs. If you have a history of gastrointestinal issues, sublingual tablets or liquid drops might be more effective than standard oral tablets. Pay attention to the form of B12 in the supplement. Methylcobalamin is often preferred because it is more readily used by the body compared to cyanocobalamin. General dosage guidelines. For mild deficiency, daily doses of 500 to 1000 mcg of B12 may be sufficient. For severe deficiency or absorption issues, higher doses, for example, 1000 mcg may be necessary, and injections might be recommended by a healthcare provider. 3. Regular health screenings and blood tests. Regular health screenings and blood tests are essential for seniors to monitor their B12 levels and catch any deficiencies early. As B12 deficiency can be subtle and progress slowly, periodic testing can help prevent long-term damage by allowing early intervention. What to monitor? B12 levels. A blood test can measure the amount of B12 in your system. If levels are low, your doctor may recommend dietary changes or supplementation. Homocysteine levels. Elevated homocysteine levels can be a sign of B12 deficiency and may indicate an increased risk of cardiovascular disease. Regular testing can help monitor both B12 and homocysteine levels. When to see a doctor. If you experience any symptoms of B12 deficiency, schedule a blood test with your healthcare provider. Even without symptoms, it's a good idea for seniors to have their B12 levels tested as part of their regular checkups, especially if they have risk factors like poor diet, gastrointestinal issues, or certain medications. 4. Lifestyle changes to improve B12 absorption. For seniors who have difficulty absorbing B12 from food due to age-related changes or medical conditions, making lifestyle adjustments can be helpful in improving absorption. Key tips to enhance B12 absorption. Eat smaller, more frequent meals. Instead of 3 large meals, try eating smaller meals more frequently throughout the day. This can help your digestive system process nutrients more efficiently. Stay hydrated. Proper hydration supports overall digestion and nutrient absorption. Aim to drink plenty of water throughout the day. Avoid excessive alcohol, chronic alcohol consumption can interfere with the absorption of B12 and other essential nutrients. Limiting alcohol intake can help improve nutrient absorption. Consider probiotics. A healthy gut plays a key role in nutrient absorption. Probiotic-rich foods like yogurt and fermented foods, for example, kimchi, sauerkraut, or supplements can help maintain a healthy gut microbiome. 5. Monitoring medications that affect B12 absorption. Certain medications commonly taken by seniors can interfere with B12 absorption. If you are taking any of the following medications, talk to your doctor about your B12 levels and whether you need supplementation medications that can affect B12 absorption, proton pump inhibitors, PPIs, and H2 blockers. These medications are commonly used to treat acid reflux, ulcers, and gastroesophageal reflux disease, GERD. They reduce stomach acid, which is necessary for B12 absorption, metformin, used to treat type 2 diabetes. Metformin can reduce B12 absorption over time. Antibiotics. Long-term antibiotic use can alter gut bacteria, which may affect the body's ability to absorb B12. Antacids and diuretics. These medications can also impact nutrient absorption, including B12. What you can do: discuss any medications you are taking with your healthcare provider to understand their impact on your B12 levels. If you are on medications that interfere with B12 absorption, your doctor may recommend additional B12 supplementation or suggest alternatives. 6. Lifestyle practices to support overall health. Maintaining a healthy lifestyle not only supports B12 absorption but also enhances your overall well-being. Here are some general tips for seniors to stay healthy and active. Stay active. Regular physical activity, such as walking, swimming, or light strength training, helps improve circulation, which supports nutrient delivery to tissues and organs. Balanced diet. Aim for a balanced diet rich in fruits, vegetables, whole grains, and lean proteins to support overall health and nutrient absorption. Mind your weight. Maintaining a healthy weight can help prevent a range of health issues, including diabetes, heart disease, and joint problems, which can impact your ability to absorb nutrients properly. Vitamin B12 deficiency is a serious concern for seniors, but with the right strategies, it can be effectively managed or even prevented. By incorporating B12-rich foods into your diet, considering supplements if needed, scheduling regular blood tests, and making lifestyle adjustments, you can maintain optimal B12 levels and prevent the serious consequences of deficiency. Regular checkups and working closely with your healthcare provider are key to ensuring you remain healthy and active as you age. In the next section, we will summarize these actionable steps and encourage you to take charge of your health. Remember, proactive care and knowledge are your best allies in living a healthy, fulfilling life as a senior. Vitamin B12 deficiency is a hidden danger that can have a significant impact on the health and well-being of seniors, often overlooked or misattributed to the natural aging process. The signs of B12 deficiency can lead to severe consequences if not addressed early. In this article, we've explored how this vitamin plays a critical role in maintaining energy levels, cognitive function, nerve health, and overall vitality. Throughout the article, we highlighted several important signs and symptoms of B12 deficiency that seniors should watch for, such as chronic fatigue and weakness, numbness or tingling in the hands and feet, cognitive decline or memory problems, mood changes like depression and irritability, digestive issues such as constipation or loss of appetite, heart palpitations and shortness of breath. We also delved into the causes and risk factors of B12 deficiency, including poor diet, gastrointestinal problems, and certain medications that can impair absorption. By recognizing the risk factors and understanding the potential consequences, seniors can take proactive steps to address their health and prevent lasting damage. The good news is that vitamin B12 deficiency is both preventable and treatable with early intervention. As we discussed, incorporating B12-rich foods into your diet, such as meat, fish, eggs, and fortified cereals, is one of the best ways to ensure adequate intake. For those who have difficulty absorbing B12 from food alone, supplements can provide the necessary boost, and in some cases, B12 injections may be required. If you're already experiencing symptoms like persistent fatigue, memory problems, or nerve issues, don't wait. Visit your healthcare provider to request a blood test and check your B12 levels. Catching a deficiency early is essential for preventing more serious consequences, such as irreversible nerve damage and cognitive decline. Make it a priority to maintain your health. Check your B12 levels regularly, especially if you have a diet that may lack sufficient B12 or if you're taking medications that affect B12 absorption. Prioritize a balanced diet. Incorporate B12-rich foods into your meals and consult with a nutritionist or healthcare provider to help tailor your diet to your specific needs. Supplement wisely, whether through pills, sublingual tablets, or injections. B12 supplementation is an effective way to correct deficiencies and maintain optimal health. Stay informed. Regular checkups are key to detecting potential deficiencies and other health conditions early on. The importance of vitamin B12 cannot be overstated, especially for seniors. As we age, our ability to absorb nutrients naturally declines, making it even more critical to monitor and maintain our B12 levels. By staying proactive, eating well, and using supplements when necessary, you can help ensure your body has what it needs to stay healthy and strong. The impact of B12 on mood, memory, and overall energy levels is immense. Restoring healthy levels of this vital nutrient can transform your daily life, boosting energy, improving mental clarity, and preventing physical symptoms that could affect your quality of life. Don't wait until the symptoms become debilitating. Take action today to safeguard your health and well-being. We hope this article has provided valuable insights into the hidden dangers of vitamin B12 deficiency and the steps you can take to prevent and manage it effectively. If you or a loved one is experiencing any of the symptoms we've discussed, it's important to take action sooner rather than later. Schedule an appointment with your healthcare provider, discuss your B12 levels, and take steps to ensure you are maintaining proper nutrition. Remember, knowledge is power, and by taking charge of your health, you can live a longer, healthier life. Don't forget to share this information with your friends, family, and loved ones who may also benefit from learning about the importance of vitamin B12. The more we spread awareness, the better we can help each other stay healthy and happy in our later years. Join the senior health community today. If you found this information helpful, be sure to subscribe to our Senior Health channel for more expert advice on nutrition, aging, and maintaining a healthy lifestyle. We provide tips, guidance, and expert insights to help you live your best life, no matter your age. Also, please like this article if you found it informative, and leave a comment below if you have any questions or thoughts. We love hearing from our readers and supporting each other in our health journeys. Take action today. Check your B12 levels. Start incorporating more B12-rich foods into your diet. Consider supplements or injections if recommended by your doctor. Share this article with your friends and family to help them stay informed and healthy. Together, we can take charge of our health and ensure that we live our later years with vitality, energy, and clarity.